If you've heard the term amniocentesis but aren't quite sure what it is, I'm here to provide some answers. All right, so this is a test that is typically done between weeks 15 and 20 of pregnancy, and it's used to assess chromosomal abnormalities in the baby, and in addition to some other things that I'm going to go over. So it consists of first an area of the mother's belly being numbed. Usually an ultrasound is done first to assess where the baby is, where the placenta is, where the umbilical cord is. Once they have a pretty good idea of, where everything is located, the best way to get some amniotic fluid. Again, they numb the belly, and then the doctor inserts a really long, thin needle through the mother's abdomen and into the amniotic sac. They then extract a pretty small amount of amniotic fluid. And again, they are really careful to make sure that this needle does not puncture, again, the baby, the placenta, the umbilical cord. It's just going into the uterus to get a little bit of that amniotic fluid. Afterwards, the mother and the baby are usually monitored for about an hour to make sure that everyone's good. And then most women are encouraged to rest for at least 24 hours after the procedure. And for any women that are Rh negative, they will need to get the RhoGAM shot within 72 hours after the procedure. Most women receive it like right after the procedure. And this is done just in case the mother's blood mixes with the baby's blood during the procedure, especially, again, if the mother's Rh negative and the baby is Rh positive, that could be dangerous. But the RhoGAM shot can help to significantly minimize any risks with that. If the mom is carrying multiples, amniotic fluid will need to be retrieved from each amniotic sac. All right, and so why is the amniotic fluid removed? So the amniotic fluid contains some of the baby's cells, which can be tested for chromosomal abnormalities like Down syndrome, spina bifida, cystic fibrosis, in addition to, inherited genetic disorders, metabolic disorders. And it can also be used later in pregnancy to determine if the baby's lungs are mature enough to survive outside of the womb. So it can be used in a few different ways. The test results usually come back within about 10 to 14 days. If the test is being used to assess how mature baby's lungs are, the results from that usually come back within a few hours. This procedure, it does pose some potential risks. So there is the pretty rare risk of a uterine infection developing or injury to the baby. Again, that's pretty rare. It has a 0.3% or up to a 0.3% chance of miscarriage, which is pretty low number. Leaking amniotic fluid, some vaginal bleeding. The risks for this are a little bit lower if the woman gets the amniocentesis after week 15 of gestation. And so, it's really important because of these risks to really, talk to your care provider about if the benefits outweigh the potential risks or outweigh the risks in your unique situation. Every woman is different. And because of the risks, care providers typically only recommend the amniocentesis for women that are 35 or older. Those that had abnormal results during, earlier prenatal testing, like from the NIPT test, from the nuchal translucency scan, if those came back showing that the baby had a higher risk of, Downs, trisomy 13, trisomy 18, then the doctor might recommend an amniocentesis to take a more comprehensive look into the baby's chromosomal health. If a woman has a child that has, that has a birth defect or, serious brain or spinal abnormalities, the amniocentesis would probably be recommended. Or if the mother or her partner, assuming that the partner is the father of the baby, that could also, you know, indicate that the mother could benefit from getting the amniocentesis. The doctors might also recommend the amniocentesis if they think that the baby has an infection or anemia, or if the mother has a uterine infection. It can be used to assess that as well. All right, if you have any questions about this or anything else about pregnancy, childbirth, or early motherhood, let me know in the comments below.